Kidney health is easy to put out of mind. Your kidneys work quietly, day and night, and most people do not feel them working. That is one reason early kidney disease can be easy to miss. If you are over 55, this is worth knowing, especially if you have diabetes, high blood pressure, heart disease, or a family history of kidney problems. Knowing what to ask about can help you and your healthcare team catch a problem early when there is often more time to protect kidney function. This video is for educational purposes only and is not a substitute for professional medical advice. Please speak with your doctor about your personal health. Your kidneys are two bean-shaped organs in the back of your abdomen. They filter waste and extra fluid from the blood. They also help balance minerals, help control blood pressure, and support red blood cell production. Every day, they handle a great deal without asking for attention. Chronic kidney disease, often called CKD, means the kidneys have damage or reduced filtering ability that lasts over time. It is not the same as a sudden kidney problem from a serious illness or dehydration. A clinician uses tests, your health history, and repeat results to sort that out. The important point is simple. Early CKD often has no symptoms. A person can feel normal, stay busy, and have no pain at all. That does not mean a kidney problem is present. It means feelings alone cannot reliably rule one out. Many people expect kidney disease to cause bad pain, but the kidneys usually do not announce early chronic problems with pain. That is why routine testing matters more than trying to guess from how you feel. There are two common tests that help give a clearer picture. One is a blood test that estimates how well the kidneys are filtering. You may hear it called eGFR, short for estimated glomerular filtration rate. The other is a urine test that looks for albumin, a protein that can leak into urine when the kidneys are under stress or damaged. This is often reported as UACR, the urine albumin to creatinine ratio. These tests work together. One result is not a personal diagnosis. Results can change for many reasons, including a recent illness, dehydration, strenuous activity, or other temporary factors. A clinician may repeat a test and look at the pattern over time. Kidney abnormalities that persist for 3 months or more can support a diagnosis of CKD. A urine albumin result above 30 milligrams per gram may indicate kidney disease, but it may need to be repeated. That is an important reason not to panic over a number you see in a patient portal. Bring the result to your healthcare team and ask what it means in your situation. Who should pay close attention? Diabetes and high blood pressure are two of the most common reasons kidney damage can develop. High blood pressure can harm the small blood vessels in the kidneys. Kidney problems can also make blood pressure harder to manage. Diabetes can damage those same tiny filtering vessels over time. Heart disease, smoking, older age, obesity, a family history of kidney failure, and some past kidney injuries can also raise risk. Having a risk factor does not mean you have CKD. It means regular conversations and appropriate testing become more valuable. For adults with type 2 diabetes, the American Diabetes Association says UACR and eGFR should be assessed at least once a year. If you have diabetes, it is reasonable to ask at your next visit whether both kidney tests are part of your care plan. If you have high blood pressure or another risk factor, ask what testing schedule is right for you. What about symptoms? As kidney function changes, some people may notice tiredness, less appetite, nausea, swelling in the ankles or feet, changes in urination, trouble concentrating, itching, or shortness of breath. But these symptoms are nonspecific. They can have many other causes, from a medication side effect to heart, lung, sleep, thyroid, or digestive problems. They do not prove kidney disease, and no video can tell you what is causing them. That is why a good next step is not self-diagnosis. It is a calm conversation with a clinician, especially if a new symptom lasts, worsens, or comes with an abnormal test. You can say, "Could my kidneys be part of this? And should we check my urine albumin and eGFR?" That question is clear, practical, and easy to remember. If you already have CKD, regular follow-up is important. Your care team may watch kidney tests, blood pressure, blood sugar if you have diabetes, and other health factors. They can also review medicines and decide what follow-up is needed. The goal is not to do everything perfectly. The goal is to notice changes early and make a plan that fits your health. Medicines deserve special care. Many useful medicines are safe when used the right way, but some can affect the kidneys in certain situations. Non-steroidal anti-inflammatory drugs, often called NSAIDs, include ibuprofen and naproxen. They can cause kidney harm, especially during dehydration or low blood pressure, and in people with CKD, diabetes, or high blood pressure. That does not mean everyone must avoid every pain medicine. It means do not assume an over-the-counter medicine is risk-free for you. Before using an NSAID regularly, or when you are sick, vomiting, have diarrhea, or cannot keep fluids down, ask a pharmacist or clinician what is appropriate for your health and medicines. Never stop, start, or change a prescribed medicine on your own because of a video or a lab result. Your clinician can tell you what is safest. The same careful approach applies to supplements and so-called kidney cleanses. Products sold as natural are not automatically safe, and some may interact with medicines or be hard on the kidneys. Avoid making a supplement plan based on advertising. Bring the bottle or a photo of the label to a pharmacist or clinician and ask. Everyday habits still matter. Keep your regular medical visits. Take medicines exactly as prescribed unless your clinician tells you otherwise. If you smoke, asking for help to quit can protect many parts of your health, including your blood vessels. Staying active in ways that are safe for you can support heart health and blood pressure. Choosing mostly less processed foods can be a helpful general direction for many people, but a kidney diet should be personal. The right food plan can differ based on kidney function, diabetes, heart conditions, weight, and lab results. Do not begin a restrictive diet without guidance from your care team. You may hear broad advice to drink more water for kidney health. Your needs can be different if you have heart failure, kidney disease, swelling, or take certain medicines. And SMART-F1. There is no one fluid amount that is right for everyone. Follow the guidance you have been given and ask your clinician if you are unsure. Let us make this practical. At your next checkup, consider taking this short list. First, ask, have my kidneys been checked with both eGFR and a urine albumin test? Second, ask, do I have any health conditions or medicines that raise my kidney risk? Third, ask, when should my tests be repeated? And fourth, ask, should we review my over-the-counter pain medicines, vitamins, and supplements? You can also keep a simple health record. Write down your blood pressure readings if you measure them at home, your medication list, and questions before appointments. Use the same pharmacy when possible, so a pharmacist has a more complete medication record. These small steps can make appointments easier and help prevent mix-ups. It is also useful to know when not to wait for a routine visit. Seek urgent medical help or emergency help as appropriate for chest pain, trouble breathing, fainting, sudden confusion, or one-sided weakness. Get urgent advice for visible blood in the urine, or a major drop in urine or no urine when you are ill. These signs can have serious causes and need prompt attention. They are not something to diagnose from home. For a non-emergency concern, call your clinician's office. Tell them what has changed, when it began, and whether you have fever, vomiting, diarrhea, swelling, new pain, changes in urine, or trouble keeping fluids down. That information helps the office guide you to the right level of care. Sometimes, the hardest part is deciding whether a test is really necessary when you feel well. Think of kidney testing like checking a smoke alarm before there is a fire. It is a routine way to gather information, not a prediction that something is wrong. Your clinician may include kidney tests in ordinary blood work, or may order them because of your health history. The urine sample is usually simple. A lab checks for albumin and compares it with creatinine in the urine to create the UACR result. The blood test is also only one piece of the picture. eGFR is an estimate, not a direct measurement of every detail of kidney health. Age, medical conditions, medicines, and changes over time can affect how a clinician understands it. That is another reason a number should lead to a question, not a conclusion. Ask when the test was done, whether it needs to be repeated, and what the next step is. If a clinician says a result is outside the expected range, take a breath. Ask them to explain it in plain language. You might say, "Is this a new change, or have you seen it before?" You can ask, "Could a recent illness or another factor affect this?" And you can ask, "What follow-up do you recommend?" Writing down the answer or taking a trusted family member to the appointment can be helpful. It is especially important to mention if you have been sick recently. Vomiting, diarrhea, fever, poor food or fluid intake, and serious infections can affect the body and kidney test results. Tell the clinician about recent changes, including a hospital visit or urgent care visit. Also bring an accurate list of prescription medicines, over-the-counter medicines, vitamins, herbal products, and powders or drinks you use. A medicine review is safer when the full list is visible. For family members and caregivers, a supportive approach works best. Rather than saying, "You need to get checked," try, "Would it help if we wrote down questions for your next visit?" Offer to help with a medication list, transportation, or listening during an appointment if the person wants that. The person's own clinician remains the right source for personal decisions. Blood pressure and blood sugar care can feel like a lot, particularly when there are several appointments and medicines to manage. Focus on the next manageable step. Keep appointments. Ask for written instructions. Let the team know if cost, transportation, memory concerns, or side effects make the plan difficult to follow. These are common challenges, and speaking up can help the team tailor support. Avoid judging yourself or someone else for a kidney health concern. Chronic conditions usually develop from many factors over time. The useful question is not, "Whose fault is this?" It is, "What information do we need, and what can we do next with our care team?" That mindset makes it easier to seek follow-up without shame or fear. If you use an online patient portal, remember that results may appear before your clinician has reviewed them with you. A flagged mark or unfamiliar abbreviation can be unsettling. Do not use a search result alone to decide what it means. Contact the office through its usual process, especially if the result is new or you have symptoms. If you are feeling very unwell or have emergency warning signs, seek urgent or emergency help rather than waiting for a portal reply. When you prepare for testing, follow the instructions from the clinic or lab. Do not make changes to prescribed medicines unless the clinician specifically tells you to. If you are unsure whether a test requires any preparation, call and ask. Clear instructions are better than guessing. One more helpful habit is to keep the conversation going across visits. If you see different clinicians, let each know about your kidney history and current medicines. Ask how test results will be shared and who to call with questions. A clear follow-up plan can turn confusing information into a calm next step. You do not have to solve every health question in one visit. Start with the 2 tests. Ask what the results mean in context, and agree on the next follow-up step. Small, clear actions are often easier to keep. There is a reassuring message here. Early kidney disease is often found through testing, not because someone felt a clear warning sign. Finding a change does not tell the whole story, and it does not mean you have failed. It gives you and your healthcare team information to work with. You do not need to memorize every kidney turn. Remember the two test names, eGFR from a blood test and UACR from a urine test. Remember that repeat testing and the full health picture matter. And remember that protecting your kidneys usually goes hand in hand with caring for blood pressure, diabetes, heart health, and medications. If this topic has made you think of a parent, a partner, or a friend, consider sharing this video with them. In the comments, tell us which question you plan to bring to your next appointment, asking about eGFR, urine albumin, medicines, or something else. Your question may help another viewer know where to begin. Take care, stay curious, and let routine kidney testing be one more quiet way to look after your future health. Dr. James Carter is a fictional AI-created health educator, not a real doctor.